Dear students, welcome back. In the previous session we have discussed about ileum. Now in this session we are going to discuss about the pubis and ischium. So now first we are going to discuss about the pubis. Okay. Yes. So the pubis forms the inferior part of the hip bone. So if you can see the entire hip bone, so it forms the anterior and inferior part of the hip bone, and it forms anterior 1/5 of the acetabulum. So anterior 1/5 of the acetabulum is formed by this pubis. Okay, and it also forms the anterior boundary. It also forms the anterior boundary for the obturator foramen. So this forms the anterior boundary for the obturator foramen. Okay, so the pubis consists of a body which is placed anteriorly and superior ramus and inferior ramus. Here we can see this one. So here this is the medial part of the right hip bone. Here we can find out this body. So the pubis is having a body anteriorly. So this is the anterior aspect, and it is having the superior ramus of pubis, which is placed superolaterally, and inferior ramus which is placed inferolaterally. So this is the inferior ramus, this one up to here, not here. So this is the inferior ramus. Okay, so these are the parts of the pubis. Now we will move on to the body. How the body is flattened from before backwards, and it has the superior border called as pubic crest. So the body is having a superior border called as pubic crest, and then a pubic tubercle at the lateral end of the pubic crest. This is the crest. On the lateral end of the pubic crest you will have the pubic tubercle. Okay, and this body is having three surfaces: anterior surface, posterior and medial surface. The pubic tubercle is lateral end of the pubic crest, forming an important landmark. The anterior surface is directed downwards. So this is the anterior surface directed downwards, forwards and slightly laterally. So if you see the position, you can find the actual thing here. Yes, so here you can find this. So the body of the pubis, so this is the body of the pubis which is directed downwards, okay, and also forwards. So once it moves downwards it appears to be forwards and laterally. So okay, this is about the anterior surface, and it is rough. Actually this anterior surface is rough, especially at the superomedial and smooth in the remaining part. Okay, so the posterior and pelvic surface, the posterior surface or pelvic surface is smooth, which is directed upwards and backwards. It forms the anterior wall of the true pelvis, and it is related to the urinary bladder. So here you can find, so this is the body of pubis. This one is the posterior aspect. So this posterior or aspect forms the pelvic surface, which is smooth, which is directed upwards and backwards. It forms the anterior wall of the true pelvis, and this part is related to the urinary bladder. Okay, if you see the medial, so this one is the medial or symphyseal surface which articulates with the opposite pubis to form pubic symphysis. So this is about the body of the pubis. Okay, now we will see the superior ramus. Okay, yes. the superior ramus, it extends from the body of the pubis to the acetabulum. The superior ramus extends from the body of the pubis to the acetabulum. So this forms the superior ramus. Okay. Above the obturator foramen. And it is also having 3 borders and 3 surfaces. The superior ramus is having 3 borders and 3 surfaces. One is the superior border, which is called as pectineal line or pecten pubis, and it is the shortest crest extending from just behind the pubic tubercle to the posterior part of the iliopubic eminence. Okay, this is the iliopubic eminence. Next, the anterior border is called as obturator crest. So this anterior border is called as obturator crest. The border is a rounded ridge extending from the pubic tubercle to the acetabular notch. Pubic tubercle to the acetabular notch. Okay, here this is the pubic tubercle and it extends like this. Next, the inferior border is sharp and forms the upper margin of the obturator foramen, and it forms upper margin of the obturator foramen. Okay, so this is the inferior border. Next, coming to the surfaces, one is the pectineal surface, which is triangle area between the anterior and superior borders. So here you can find the area called as pectineal surface, which is triangular in shape. So this is the triangular area which is present in the superior border and the anterior border, in between the anterior border. And coming to the pelvic surface, which lies between the superior and inferior borders, which is smooth and continuous with the pelvic surface of the body of the pubis. Next one is the obturator surface, lies between the anterior and inferior borders. It presents an obturator groove. So here, so this is the anterior border. It forms the upper margin. So in between these two, you will have the groove called as obturator groove. Okay. So this is about the superior ramus. Now we will move on to the inferior ramus. So the inferior ramus, it extends from the body of the pubis. So it extends from the body of the pubis to the ramus of the ischium, to the ramus of the ischium. So up to here. So here the ischial ramus will start. So up to the ramus of the ischium. Okay. This inferior ramus unites with the ramus of ischium to form the conjoined ischiopubic rami. So because of its fusion with the ischial ramus, it forms an conjoined ischiopubic ramus. Okay. So this is about the pubis. Now we will see the ischium. Okay, the ischium forms the posterior inferior part of the hip bone. Okay, so yes. So it forms the posterior inferior part of the hip bone and the adjoining 2/5 of the acetabulum. It forms 2/5 of the acetabulum, whereas the pubis forms the 1/3 and the remaining by the ilium. 2/5 of the acetabulum is formed by the ischium bone. It forms the posterior boundary of the obturator foramen, whereas the anterior border is formed by the pubis, whereas this one forms the posterior boundary of the obturator foramen. The ischium has a body and a ramus. So here this is the body. The body is thick and massive mass of bone that lies below and behind the acetabulum. So if you see the acetabulum here, below and behind the acetabulum the ischium is present. Okay, yes, and it is having two ends. The body of the ischium is having two ends, one is upper and lower end, and it is also having anterior, posterior and lateral borders, three borders and three surfaces: femoral surface, dorsal surface and pelvic surface. Now we will see the two ends. The upper end forms the posterior 2/5 of the acetabulum. So this becomes the upper end, which forms the posterior 2/5 of the acetabulum. Okay, the ischium, ilium and pubis fuse with each other in the acetabulum. The lower end forms the ischial tuberosity. So this is the ischial tuberosity. The lower end forms the ischial tuberosity. So upper end forms the posterior inferior 2/5 of the acetabulum. So this part is the upper end, and lower end forms the ischial tuberosity. Okay. So this ischial tuberosity, that means the lower end, gives off the ramus of the ischium, which forms an acute angle with the body. So it gives a ramus. Okay, this is the body, isn't it? And it gives a branch like this, and it forms an acute angle here with the body. Because of this ramus, it forms an acute angle. Okay, for example, this is the body, and here this is the lower end, and it gives a ramus. So because of this ramus, it forms an acute angle with the body. Okay. Next, and also it is having three borders. So the ischium is having, the body of the ischium is having three borders. One is the anterior border, posterior border and lateral border. So this anterior border forms the posterior margin of the obturator foramen. So posterior margin of the obturator foramen forms the, here you can see this is the posterior margin of the obturator foramen, forms the anterior border of the body of the ischium. Okay, this posterior, next the posterior border is continuous above with the posterior border of the ilium. So the posterior border continues above with the posterior border of the ilium. Below it ends at the upper end. So this below it, the posterior border ends at the, so this one is the anterior border, isn't it? The posterior border of the body, it moves upwards with the ilium, and it ends at the lower end, it forms with the ischial tuberosity. It also forms part of the lower border of the greater sciatic notch. So it also forms the lower border of the greater sciatic notch. Okay, below the notch, the posterior margin shows a projection called as ischial spine. So below this margin, a projection called as ischial spine. Below the spine, the posterior border shows a concavity called as lesser sciatic notch. The lateral border forms the lateral margins of the ischial tuberosity. So the lateral margin forms the lateral border of the ischial tuberosity, except at the upper end where it is rounded. So this one, the upper end, except that part. Okay, now we will see the surfaces. It is having three surfaces. One is the femoral surface, okay, dorsal surface, and then the pelvic surface. The same way. So the femoral surface lies between the anterior and lateral borders. So this becomes the femoral surface. And dorsal surface is continuous above with the gluteal surface of the ilium. So this becomes the dorsal surface. Okay, from above downwards it presents a convex surface adjoining the acetabulum, a wide shallow groove, and the upper part of the ischial tuberosity. So if the femur is not present, then we can find such kind of discrimination here. Okay. Now the ischial tuberosity. So if you move on to this ischial tuberosity, we can see seen behind and below. Okay, the ischial tuberosity is divided by transverse ridge into an upper area and the lower area. Okay, the upper area is subdivided by an oblique ridge, okay, into superolateral area and an infero-medial area. The lower area is subdivided by longitudinal ridge into outer and inner area. Okay, simply we can say it is as upper and lower parts, and it is divided into upper medial and upper lateral, and lower medial and lower lateral. The pelvic surface, if you move on to this, so this becomes the pelvic surface. This is the internal aspect. The pelvic surface is smooth and forms the part of the lateral walls of the true pelvis. It forms the lateral walls of the true pelvis. So this is about the pubis and ischium. In the next session, we are going to see the attachments, that is muscular attachments as well as the ligaments attachments to ilium, ischium and pubis in the next session. Thank you.